Welcome back to Pittsburgh Living on KDKA TV. I'm your host, Carol Lee Espy, and today we're featuring 8 excellent tri-state businesses. Now coming up, we have Dr. Nathan Lockery from Aspen Dental and Cookie Harris from New Image Hair Clinic. But right now, let's welcome Danielle Bodner from Life Pittsburgh. Welcome to Pittsburgh Living.
Oh, thank you for having us.
Tell us exactly, what is Life Pittsburgh?
Life Pittsburgh is living independence for the elderly. The whole goal, the whole mission of this program is to help seniors stay at home for as long and as safe as possible. It is for individuals 55 years and older who might have some sort of medical condition that makes them need some sort of assistance to
some
stay
looking
at
after
home.
and some
Yes.
assistance, yeah,
Of course.
because they want to keep their independence.
They do.
Now, what makes this different from anything else that would be a Medicare-based plan?
Sure, this is an actual Medicare, Medicaid program.
Okay, wonderful.
The biggest difference with this program is the coordination of care. We're calling, scheduling doctor's appointments for them, doing all the follow-up work, providing transportation for the individual to get there, and making sure whatever is needed medically is going to be put into place.
So you actually have someone acting as your personal secretary in a way. They're making sure all of this gets coordinated for you.
Really, that's exactly
out of your
what
home,
we're doing.
so you get to stay in your home.
Right.
What about the doctor-to-patient ratio?
We have all geriatric specialists who are at each of our centers. We have 4 centers throughout the area of western Allegheny County.
Okay.
And you know, those doctors, it's really about easy access to care. You know, there's no appointments needed. If it's not an individual's day to come in to see the doctor, we're able to have our transportation go out, bring the individual in, see
wonderful.
the doctor.
And the more independence they have, really, actually the healthier and happier they stay. in
Right.
many. Now, as you get older, it's never just one problem. You have a lot of can have a lot of multiple health issues. So how do you coordinate all of that?
Sure, and that really stems from our team approach. You know, we have the geriatric specialists, the doctors, we have nurses, we have social workers, dietitian, physical and occupational therapists. We're actually providing all of those services, including home health care, but we're also taking it one step further and being the quarterback. Again, we're scheduling those doctor's appointments. We're providing the transportation for the individual to get there, as well as receiving all of the information back to make sure whatever is needed is going to happen.
You're assembling a whole team to take care of this one person.
Exactly.
That's pretty amazing.
And it is all based on that individual's needs.
That probably saves, I mean, instead of having to go into assisted living, which can be very expensive, that probably saves them a lot of money.
It not only saves the individual a lot of money, it actually saves the government a lot of money.
Yes.
By providing these services in the community. You know, aging in place is where we want to go. You know, individuals do want to live in their own home or in their apartment or with their family.
Now you say you're very proactive. How would you describe?
I think that comes back again to the entire team. You know, we have our occupational therapists that are going out to the home to do safety assessments.
That's something that we overlook quite a bit, because you do need to go through the house and see what are the hazards.
Exactly.
They do it with babies. Why wouldn't you do it as you're elderly and you have more challenges even just moving around? Why wouldn't you do that?
Right.
Yeah.
We're looking, making sure there's no throw rugs on the ground. We're picking those up. You know, and it's not only that, it's about getting them to see the doctor. You know, these individuals oftentimes have specialists, cardiologists, neurologists. They have their eye doctor, their ear doctor, and they're questioning, how am I getting there? Who's going with me? How am I going to remember everything that I need to do? And that's really where we're proactive, scheduling those appointments for them and doing all of the follow-up that needs to happen.
And once again, what areas do you serve?
We actually serve the western portion of Allegheny County. There are several life programs in the surrounding areas, so if an individual has a question, all they have to do is contact us and we can refer them out to the appropriate life program.
And you also work with relatives who are, you know, a lot of times in Pittsburgh you have the elderly parents who are still here and the kids have all moved away. You can coordinate with the kids and help with that.
Yes, we can definitely keep in touch with the children, making sure that they're aware as to what's going on with their loved ones.
And then also, I guess this is one of the big questions. So since it is Medicare and Medicaid based, it's a lot of this care is paid for, all of this care, or does it depend on case per case?
Actually, as long as they qualify for medical assistance, this program is completely free for the individual. So this is covering everything top to bottom. That's including those doctor visits, that's including the transportation, all their medications, all their medical supplies. You know, anything that they would need to stay at home.
So what's the first step in setting this up?
The first step is getting in touch with us.
Okay.
We have staff that are able to answer their questions, and we would walk them through every process or every step of the process.
Right. And you send someone out to the home, get it all together, coordinate with their doctors. And do their doctors have to change, or they can keep their doctor?
You know, the primary care physician, those geriatric specialists that are at our center, do become their healthcare doctor.
So you need one central person who's going to coordinate all of this, so it makes sense.
It really comes down to that entire team working together. It's not just the doctor making the decision, it's everybody making the decisions, including that participant and their family.
And I think it really helps if you can stay in your home and not have the shock of having to, moving is very, very hard even for someone in their 50s to someone in their 80s. It's a very big strain.
It is.
And it's nice to be able to stay in your home, you're familiar where everything is, and the people can come to you. It's a wonderful service. Thank you, Danielle.
Sure.
So it seems like we covered most of it, almost all of it, but is there one last thing you'd like to leave us with about Life Pittsburgh?
You know, there is always. If somebody is out there who's listening and they think this program could help them, to please call us today. Also, if they're not sure about the program and have some questions, you know, pick up the phone and call us. As well as if they're a procrastinator, you know, do it today.
Just
don't
do it now.
wait. Yeah, don't wait till a crisis happens.
Till a fall happens and
it leads them to the hospital, and then who knows what. So the program's here to help and help them stay where they want to stay.
Well, we would be sure to put your phone number here and also your website so that folks can contact you right away. But what would be a typical question that someone would be asking you when they call?
You know, always, what are the financial requirements
I
for
would
the
think
program?
that's a big one.
And what services do we provide?
And do I really get to stay in my home?
Do I really? And is it really free? It sounds too good to be true.
But and it's amazing too when you say we're saving a lot of money by not moving out of the house, by actually being there and getting the help that you need.
Sure.
Wonderful. Well, thank you so much for being here, Danielle.
Sure.
And if you'd like to know any more about Life Pittsburgh, you can just give Danielle a call at 412-388-8050, or you can log on to lifepittsburgh.org. Now, if you would like to advertise your products or services on Pittsburgh Living, you can give us a call at 412-575-2400 or email us at showcase@kdka.com. And up next, we will talk with Dr. Nathan Lockery from Aspen Dental, and Pittsburgh Living continues.